So thank you so much for joining me, Georg. And I've worked over the years, so it's a real pleasure and honor to have you on the show on a topic that, I think we're both quite passionate about. Could you briefly just tell me a bit about yourself and your work and your interest in this field? And then we'll kind of get a bit more stuck into sort of what is stigma and how it applies to alcohol dependence.
Yeah, thanks, James, for having me on your podcast. It's an honor. I mean, I started I'm a psychiatrist. I'm a clinical psychiatrist. Now I'm a director of a psychiatric university hospital. And I started as a general psychiatrist and was interested in stigma in general. And then I changed position and came to be the consultant of a substance use ward, really, a detoxification ward. And I thought, as a stigma researcher, that's really a good place to be, because obviously people who have substance use issues are highly stigmatized. And it was obvious that even within psychiatry, this group of patient was kind of on the bottom of the ladder. So it was always hard to get people who had a severe depression, for example, from the detoxification unit to the psychotherapy ward, because there were all kinds of thoughts, well, maybe they will relapse, or maybe that's too difficult, so all kinds of reservations. And I thought, well, these patients are so disadvantaged in terms of the care they receive and how they are treated. And so I thought, well, it's important to address the stigma of substance use disorders. And I found out that there was very little literature on that, because it seemed as if in the stigma literature there was also some kind of stigmatizing people with substance use disorders, and it was easier to talk about the stigma of depression and the stigma of schizophrenia, probably because these are illnesses where you don't blame the people who get them. It's clear that they are the victim of their illness, but it's more complicated with substance use disorders, because substance use is something that people do. So there is some kind of responsibility. And I found out that we really have to see substance use stigma in a particular way. It's not the same stigma as all the other mental disorders. There's something special about that, and that arose my interest. And so I started working on this topic, and I'm still enjoying it, because I still think there's a lot we can understand about how we as a society use substances, how we deal with people who have substance use problems, and so on.
That's fascinating, and yes, and when we see it in practice, that really kind of does bring home how important it is. And and as you were talking there, I was thinking about the uniqueness of the stigma of alcohol dependence. So I think we'll focus on that. Obviously, there's a whole range of ways we could explore stigma applied to alcohol. Drinking or different drinking behaviours. Women are often more stigmatized than men, particularly if there's ideas around, or particularly if, pregnancy is involved, etc. Yeah, and alcohol as a drug is, despite its legality, people who are seen as problem drinkers or alcohol dependent are as heavily stigmatized as, almost any other group, if not more, on many measures. Could you say a bit more about the stigma of alcohol dependence, particularly how you see that, and also how we should kind of understand stigma, maybe from a kind of theoretical or purist's view, if you like, and then we can maybe talk about how it's maybe used in other ways.
Yeah, yeah. I mean, first of all, stigma is a group process, and the outcome is that a certain group is devalued and discriminated against. And this process has mechanisms, and I think Bruce Link and Joe Fallon described them pretty well in 2001. They pointed out that it starts with labeling the group, and I mean, being an alcoholic or an addict, I mean, that's a really strong negative label. And with these labels, you associate negative stereotypes like being weak-willed or being lazy or dangerous or irresponsible or whatever. And that leads to an emotional reaction, anger or fear or annoyance or disgust or whatever. And that leads to a cognitive separation of us, those who are not stigmatized, versus them, the stigmatized group. And this othering gives rise to makes it possible to devaluate the others and to discriminate them against. And I think the stigma process is a very present force, actually, because if you're just looking over the Atlantic to the United States and just listen to what Donald Trump is saying about groups he would like to discriminate against, which is foreigners or migrants, or then he's kind of labeling them as criminals, as rapists, as whatever negative label, and he's associated severely negative stereotypes with them, and he's really trying to evoke emotional reactions to make people angry about them, to be able to justify policies that are so cruel and so they used to be unthinkable, but with these emotional force that he creates by the stigma process, it's really possible that things happen that we wouldn't thought possible 2 years ago.
Yes.
So I think that's really something, a very powerful process that targets people with alcohol problems as well.
Yes. Yeah, I think that's so important to bring in the wider, kind of global context of stigmatization processes more broadly. And yeah, there's, some really good work, like, again, the stigma power theory that, people use the kind of stigmatize, exactly as you say, as a dehumanization process. And we see it throughout history, throughout some of the worst atrocities in modern times have followed these kind of dehumanizing narratives that build up outgroups, and anti-Semitism and so on as some of the most famous cases. So I think it's really important to understand that stigma isn't just about negative stereotypes and judging someone as unfairly or whatever. That it really is about mistreatment and really does result in really bad outcomes, particularly if we look at it in the more kind of global and socio-political context. So yeah.
And then, I mean, you have to ask why does stigma happen in the first place? I mean, we are not evil, but still we stigmatize. So I think it's important to see it as that it serves a function, that it has a purpose, that something is achieved by stigmatizing a group. And when I came across Jo Fallon's work on stigma and prejudice, I was really struck by her hypothesis that there are three basic functions of stigma. One is keeping people down in the tradition of slavery or also patriarchy. I mean, having a group that we oppress to save our well-being or our advantages, which is it's not the case in alcoholism stigma, because there's not really an advantage from that, maybe, or at least not at the first sight. And then there is the stigma of keeping people away for fear of contraction of a disease, for example. The leprosy stigma would be a good example. And there's also the stigma of keeping people in, which is a moral stigma, stigmatizing a behavior that is deemed unnormal or something that we don't want to have around us. And she says that substance use and criminality, and I think also things like homosexuality, they are stigmatized because of that. I mean, people don't hurt others by being homosexual or by. With criminality, it's different. So it's complex. There is a norm, and there is the notion that people violate this norm, and for violating this norm, they are stigmatized. And in the case of alcohol use, if someone uses too much alcohol and does not control his alcohol use anymore and is behaving in a way that we don't want them to behave, then we stigmatize them. I think it's plausible to see stigma as a kind of moral signaling that this behavior is not okay. So I think this moral side of the alcohol stigma is really important to keep in mind, because it explains a lot of the negative interactions that people with alcohol problems face when they seek help, for example. So they are sometimes treated unfriendly because people have the urge to signal to them, I will help you, but I do so reluctantly because what you're doing is not right. You are stealing my time. Now you're in my emergency department drunk, and of course I help you because I have to, but I'm trying to make you feel that what you're doing is not okay. And even if people are very professional, they still manage to transport this kind of condescending moral view that the person seeking help is not really deserving because they made a mistake by getting into this position anyway. So I think this moral side is really important.
Yes. Yeah, and And I think understanding those emotional drivers of stigma is so important. But I guess they can kind of come together as well. That people may both have a mix of emotions. They might feel like the kind of avoidance thing because of fear of dangerous behaviour or whatever, and in turn also have anger and contempt. Those are some of the emotions that are sort of seen with the kind of moral condemnation type stigmas. So I guess that it's a complex mix, isn't it? And you've done some really interesting work kind of unpicking some of those, how those different things might be going on at the same time, which means it's often so complex.
Yeah, but it's really complex because obviously we are not stigmatizing the use of alcohol. On the contrary, we encourage use, also heavy use of alcohol. In Germany we have the Oktoberfest, which is a celebration of drinking excess. So we can't say that it is socially unacceptable to get drunk. It is not. It is totally acceptable. And so you can't really say that the dangerous behavior which comes from being intoxicated is stigmatized. It's not. We tolerate that because we all like to drink. Instead, we stigmatize the addiction, the notion that someone has lost control. So we have the illusion that we can all control our alcohol intake. But if someone has lost control, so that is the crime, losing
Yes.
control. So I think, and that's from your work actually, James, that I thought, okay, it's not really trying to keep people from drinking. It's also trying to keep a safe distance between my own drinking behavior and the behavior of those who I call the others.
Yes.
Also, it's not only a moral stigma, it's also a self-affirmative stigma. So by stigmatizing the others who drink too much, I'm kind of affirming myself that my drinking is still okay, as long as I'm not drunk on the streets or in front of the supermarket with cheap beer or spirits. As long as I'm still able to work and to function, I have friends, and so I know that I'm drinking too much, but still I can minimize the problem as long as I'm able to construct a difference between me and those who drink really a lot and who are really
Yes.
addicted. And so I
Yeah.
think the stigma is really a kind of mechanism that is it's completely useless in controlling alcohol use, but it's very useful in keeping a distance between my own more or less heavy use and the others, so that I can kind of ignore the drinking problem of my own.
Yes. Yes. So much in there that, we could probably discuss for hours. But yeah, I absolutely agree that when we look at how people construct, even when, or in particular, heavy drinkers who, are not identifying themselves as having an alcohol problem of any sort, will draw on those extreme stereotypes, kind of rock bottom narratives maybe of, and having a severe physical alcohol dependence where you need to drink in the morning, but you can't fulfill your duties anymore. Those are the stereotypes of extreme alcohol problems that many heavy drinkers draw on to other. Yeah. And I think it's kind of quite strongly tied to, maybe this historical moral model of addiction, which is also born out of, a kind of contemporary capitalist society, which places our value a lot on our ability to work and perform our duties as an individual. So I think, it's kind of deeply embedded in that. Lots of different types of stigma are deeply embedded in that. I would argue kind of a lot of mental health stigma or a lot of mental health models are based on whether people are able to kind of contribute and work to society in the kind of traditional or in this kind of capitalist sense but maybe I'm digressing a bit, but essentially, yeah, I think there is that very strong moral component of stigma of alcohol dependence that essentially, yeah, boils down to characterizing someone as a bad apple of a bad person, rather than all the kind of complex reasons that we know contribute to alcohol use and problems, and particularly as existing as a spectrum. There is no clear line between people with alcohol problems and people without, in contrast to how this kind of stigmatizing narrative really frames and focuses on this extreme outgroup.
And it also leads to that the more I drink myself, the more important is it for my own self-worth and safety of my self-image that I construct the alcoholic as even worse. So the more I drink, the dehumanizing and the more drastic is my stereotype of the alcoholic, just to keep that safe distance. And we can in fact see that people who are heavy drinkers themselves, the more they stigmatize others, the less they are able to see their own risk that is within their drinking habits. So it's a kind of way of, I'm feeling safer if I'm putting the other as far away as possible. And so that is kind of fueling the stigma of people with alcohol problems, because they always have to be worse than I am.
Yes. Yeah, I think it's a paradox that a coping strategy for stigma of othering the problem, labeling and constructing this severe, in inverted commas, alcoholic stereotype is a stigma self-protection mechanism, but paradoxically that you're increasing stigma by, really reifying this severe, extreme, sort of bad character stereotype.
And it becomes more and more difficult to see your own problem. I mean, if I'm in this process of really devaluing the others, then it's even more difficult to see the problem with myself. I mean, this moment of self-stigma when I'm sitting at home and contemplating my own drinking habits and think, well, it is too much, but then I have to use these negative stereotypes that I entertain against myself. And that is so painful that it's really easy to avoid that and say, well, I'm still not as bad as someone else.
Yes. Yes. And that's, we said we'd kind of come on to the, what maybe works to reduce stigma and, continuum beliefs or models. Yeah, through broader mental health literature and some of the work we've, kind of discussed or been involved with. You pioneered some of this really important continuum model experiments, but appears to show, that people sort of associated with less stigma, but also maybe more problem recognition. I think because it potentially avoids that need to consider oneself as with that outgrouped or extreme othered stereotyped identity, and then instead can just kind of think about maybe risk of use as more of a kind of dose response thing. The more I drink, the more it's not good for me, rather than needing to think about it in terms of this bad character person that you become if you have that label.
Absolutely. Yeah. No, I think that's really important, because in reality, there is no clear threshold. I can't say, well, today I'm addicted and last week I wasn't. I mean, that's not. It's a process, and it's a matter of severity. And in terms of health consequences, it's a matter of amount of alcohol over time. And the question of addiction is really irrelevant in terms of cancer risk or also the social risk. I mean, if I'm driving drunk, it doesn't matter whether I'm addicted or not. It's my alcohol level at that moment that is doing the harm. So I think it's really, there are a lot of good reasons not to focus too much on addiction or not, yes, no, but rather on the severity of the problem.
Yes.
On many levels.
Yeah, so, Jürgen Rehm and others have kind of argued, for a heavy use over time model of substance use, that maybe focuses more on the point that you make really about the level of risk or harm rather than addiction, which is obviously a very contested, often criticized concept for all sorts of reasons. And all those things that people often think about of addiction are often very dynamic. They're not a fixed state. They change from one day to another, and they're very context dependent as well. Even, particularly impaired control, which is maybe the key stereotype or characterization of addiction in the public's mind. Losing control of it is very dependent on the circumstances, who the person's with and what their environment is and how they're feeling on that day. Yeah.
I think you're making a very important point, because that also touches on the issue of responsibility. I mean, we are really used to view responsibility as an individual issue. I'm responsible for what I'm doing. I mean, that is our culture, and that is we all strive to do more exercise, to eat healthier, to spend less time on our phones, or all kinds of things that we think we are responsible for. But obviously, every action happens in a social context, and that is particularly true with drinking, because it's such a social thing, and also a thing that we learn, and that is enabled by the availability of alcohol, by the cultural way when we drink, how much we drink, what is appropriate, and what have I seen with others, how do they drink. So it's a very social thing to drink alcohol. So it's the amount I drink or my ability to abstain from drinking is really heavily dependent on my circumstances, which I see in a very broad way. I mean, we have large country differences in per capita alcohol intake, and they obviously reflect cultural and political and societal differences that make it more likely to drink or less likely to drink.
Yes.
And so I think we have an individual responsibility, no doubt, but we have also a very, very large social responsibility at the same time. So in every situation, there is me having an intention or a goal and a kind of a preference. Maybe I've got the preference not drinking today. And then there is my environment and somebody who is really friendly and is kind of bringing me a drink. And then maybe I change my preference and I drink. And that was not my initial intention, but it is the circumstances who just brought me to. So we are all kind of susceptible to these circumstances.
Yes.
And with using an addictive substance like alcohol, our ability to take individual responsible is also affected. It diminishes because if I'm a heavy drinker, it becomes the more I drink, the less I'm able to control my drinking, and the more addicted I am, or the more used I am to drinking in the first place, the more impulsive my drinking is and the less I'm able to control my drinking. So the more severe the problem is, the smaller is my capability to take individual responsibility. And at the same time, the more important is my social environment. So if I have a very severe alcohol problem, I need a very protective environment that helps me to abstain. And it's good if I have that. And in this dynamic model of responsibility, the severity of the problem is indicative of the amount of responsibility I can take, or the amount of social responsibility I need from my surrounding or from my peers or from society, whatever. And recovery is then a process of regaining individual responsibility with the help of my social environment, which is kind of in an ideal world, it is supportive and is kind of helping me to extend my ability to regain control. And maybe the result is that I'm able to go shopping without struggling at the alcohol section of my supermarket.
Yes.
Which is hard, really, at the beginning, and it will become easier and easier. Or it is that I can live on my own and I have a stable abstinence, whatever is the goal. But I think it's really important to see this interaction between the social environment or my surrounding, my peers, and my own responsibility, and that this is dynamic and that it is absolutely, it's nonsense to frame a substance use problem as a problem of individual responsibility in its entirety, which is often done because that ignores the severity of the problem and how addictive alcohol is.
Yes.
Yeah, so I think we really have to frame that as a dynamic interplay between a social context and an individual, and the goal is to regain as much responsibility as possible in an as supportive as possible environment.
Yeah, I mean, I totally agree. And I think it applies big picture with alcohol problems as well, that, we know the most effective ways to reduce societal level of alcohol problems or alcohol problems at the societal level is through controlling the price, advertising and availability. There's no question about that. But, most, Scotland's been a bit of a pioneer, but has faced massive challenges from sections of the alcohol industry, not just through the legal routes, but also through the kind of battle to control the narrative about what alcohol problems exist as. And obviously, sections of the alcohol industry have promoted a personal responsibility or individual responsibility narrative that really frames it so that, a person is in control of their alcohol use, and therefore people that drink or have problems, there's something, inverted commas, wrong with those people, not the environment. So yeah, we really need that to reframe that understanding, change that public understanding, so the public in turn support the environmental controls, the environmental responsibility as well as shifting from the individuals.
Absolutely. And I think the alcohol industry is using stigma as a tool because this narrative of responsible drinking, of informed drinking, risk-informed, responsible, moderate, blah, blah. I mean, that is really, I mean, between the lines you read, the others, they are irresponsible, they are incompetent, and they are the minority. I mean, we have the majority who drink responsible, and we shouldn't regulate them because they don't have a problem. And so they're really making this argument at the cost of a minority, of a vulnerable minority that would need protection, but that is somehow deemed not worthy of this protection. And I think that is a direct effect of the stigma process, who not only leads to discrimination, but also to devaluation. And people with addiction are so devalued that it is really things of making policies in their interest, because their interest just doesn't count. It's the interest of the majority, of the moderately drinking, self-confident majority, and not the interest of the really large minority of people who have or had alcohol problems and who feel still ashamed by their problem and who feel the stigma and who don't have the position to protest against this irresponsibility. I mean, it is so, I think it's honest, it's disgusting. I mean, I don't know how it is in Britain, but in Germany you have at the cashiers or in the supermarket at the where you pay, you have these
videos,
stacks
cameras
of sweets and everything
Yes.
that you are supposed to buy impulsively. And you also have these small bottles of spirits for, don't know, €2, €1. So it's really, it's kind of, it's made for someone who has a drinking problem to lose control at the last moment and say, well, I'll take the small one. And that is so, I mean, it's absolutely irresponsible.
Yes, and we're seeing the same, with the rapid rise in gambling related problems, because people are so, being so exploited by the availability of smartphones and the, taking advantage of our impulsive kind of nature. And it's just, it's just all around us now. And of course, the gambling industry, or again, sections of it, are really heavily focusing on this. There's so many adverts here in the UK about, promoting their kind of responsible gambling, messages and so on. And what they're really doing is framing it as an issue of personal responsibility to try and, allegedly to stave off legislation. But it's the same playbook, isn't it? We've seen it time and time again.
Absolutely. And it's cynical. I mean, the alcohol industry does most of its revenue with people who drink unhealthy. And so it's per se, they are living from the irresponsible drinking. And then framing it as the majority is drinking responsibly, it's a lie, and it's dangerous. It's minimizing the risk, the health risk, the social risk. I mean, the risk for unborn babies. There are so many. I read that in Germany, the most frequent disability at birth, which is not genetic, is fetal alcohol syndrome. No, I mean, including the genetic disability. So it's the most frequent disability and that is horrific, because these babies, I mean, they have done nothing wrong, and you can't put all the blame on the mothers, because in a drinking culture where you really get othered and excluded if you don't drink, we can't really say that it's the fault of women who often don't know that they're pregnant when they conceive. So there's a lot of double standard and cynicism, and there's a big financial interest. And at the beginning I said that keeping people down is not really a motive for alcohol stigma, but I think in a way it is, because it is in the interest of the alcohol industry to keep people with alcohol problems down, to make them morally tainted so that they can't complain, so that they have to blame themselves rather than the industry or others.
Yes.
And to keep them in this powerless position so that they can continue to buy the products of the alcohol industry. And now going even a step further, that is a pattern that we see also with the food industry and with the oil industry. I mean, we have seen that with the tobacco industry, but we caught them. I mean, we know that everybody knows that tobacco is really has an enormous health risk, and so things have moved there. But they haven't moved with high processed foods, and they haven't moved with, I mean, for 30 years we are trying to reduce our consumption of fossil fuel, and it's still rising.
Yes.
And that is obviously also, I mean, it's the same pattern.
Yes.
The pattern is to blame the individual in order to prevent regulation that would infringe on my profits.
Yes, and I even read recently the same when I was reading a book by Jennifer Jacket about the use of shame in inverted commas to kind of change behaviour. She argues a lot of the same, and that the kind of invention of recycling was a kind of clever strategy to place the responsibility of mass producing disposable throwaway plastic back onto individuals rather than the companies that are just creating plastic to make as much money as possible because it's the cheapest way to sell as much of their product as possible. So even recycling, I mean, I'm not saying people shouldn't recycle, but we should be aware that the whole idea of recycling was deliberately generated by, again, sections of big industry to try and frame it as an individual responsibility issue.
Yeah.
And I think with alcohol problems, something else that played into the hands of those wanting to frame it as a problem of kind of individuals rather than the societal factors, it has kind of coalesced with the sort of alcoholism model as well, which obviously presents people as having, again, a dichotomy, you either are or you aren't, under that, traditional alcoholism model. And again, that sort of plays into the same thing, that there's maybe one group of people who are just seen as genetically or fundamentally different, and everybody else is a kind of responsible drinkers, again, in inverted commas. So, I do think sort of the models that we think about and, avoiding sort of alcoholism model for me is really important in terms of public health goals, particularly in terms of moving towards a more continuum understanding where we don't separate and outgroup an extreme stereotyped model. I think alcohol dependence or alcohol use disorder, they have their limitations and issues, but they're obviously preferable. But do you think maybe, we've had some really interesting discussions in the past about this. Do you think like an illness model is useful in clinical contexts? I mean, it goes back to the role of blame, and I think maybe in the public context, the role of blame and responsibility perceived towards problem drinking is maybe different, but still really important. But, in the clinical context, do you think blame is really what drives a lot of the clinician or stigma towards people who, are in contact with services?
Yeah, I think so. If you have a severe drinking problem, I think it's really helpful to frame that as an illness, because then being ill entitles you to get help, and it also relieves you from the responsibility that you have to do it all on your own. And I think it's also, I mean, in many people, it's an ongoing problem already. You have periods where you recover, and then you have a relapse, and then you have to try again. And then I think it's helpful to see it as a chronic illness, because that is something that you have to accept, that you will always be vulnerable in certain ways, and it's well possible that you will have there will be ups and downs, and there is no moral shame to having a drinking relapse, but it's bad, and so you have to try to do the right thing and try to get rid of alcohol again. So I think it's, in many circumstances, it's a good way to, and I think it's also in the reality of people with severe problem. It's clearly it's an illness. I mean, it is so severe, and it's so, you need a lot of help, energy, hope, empowerment. I mean, it's a heavy burden, and in framing it as an, I think. I mean, obviously, it's not an illness with a clear cut, yesterday I was ill, today I'm healthy, but I mean, many illnesses are not. I mean, having diabetes or...
High blood pressure, for instance, has an arbitrary threshold that we use to diagnose hypertension, and then it's considered an illness. I mean, I guess, I agree with many of your points that, there's so much blame and that for some people, it's a lifelong challenge and, returning to problematic drinking. Even the term relapse, I think, is kind of problematic because, again, it's so embedded in the stereotypes and sometimes can become sort of self-fulfilling, particularly ideas like, if you have one sip, then you're going to relapse and it becomes self-fulfilling. There's some research that kind of shows that abstinence violation effect. So I guess, yeah, I guess I always struggle with, disease and illness. Like you say, there's no cutoff. And yeah, so it's maybe more in a metaphorical sense. If it works for somebody or if it works for people to frame it and think about it in that way. And, of course, Alcoholics Anonymous is, a model of understanding alcohol problems that's, not based on kind of empirical clinical science, but it's based on a model that has shown to work for many people who embrace and adopt that model because it helps them make sense of their problem and know that there's no way I can touch a drop of alcohol and I need to connect with my peers and support others. And so there's a kind of pragmatic case, I think. But yeah, I guess when I really boil down to thinking about, what is illness and what does it mean, I'd probably have a slightly different opinion than you, if that's okay.
I mean, illness it's a convention.
Mm.
It's
Socially constructed in some ways. Yeah.
yeah, but I think it's a useful construct that I think is useful. Yeah, and it's helpful, and it's for very pragmatic reasons, just being entitled to healthcare benefits,
Mm.
but also in terms of strategy. So how do I my next steps, and then I need help, or what kind of help do I need? How long do I need it? And then there is recovery, and I think recovery, I mean, if you have illness on the one hand side, you need recovery on the other hand. There's a concept to describe that you can always move in the right direction, that recovery is a process of healing and of regaining autonomy with regard to your life and your choices.
I mean, I still think there's, critiques of, yes, if we label things as illnesses to get care and treatment, but that's, it doesn't have to be that way. In a sort of maybe idealized future, we wouldn't need to justify giving people support and care because they've got an illness. Maybe I'm being too wishful in my thinking, but I kind of feel a bit like, yeah, like some of these constructions are pragmatic in the current context, but that we should be thinking about what's the real longer term, more beneficial framings. And I think some of the similar arguments are made about recovery, that it's still a kind of deficit model, that we should be thinking about people's strengths and their goals rather than thinking about, they've got this addiction problem and they need to recover from it.
Well, it's interesting because
Yes.
because in the mental health field, recovery is really a focus not on the deficits, but on the gains and on the possibilities. And I think it should be in the substance use field as well. I mean, it's
Yes.
not.
I think there's been efforts to kind of turn it that way, and that's obviously a positive thing. But yeah, I think there's still some critiques or people who would rather just abandon the term altogether. But you're always going to get that, aren't you? And what about other ways that we should think about trying to reduce stigma of alcohol dependence? I mean, I'm a bit conscious we haven't included anyone with lived experience in this podcast, but I'm always open about my own lived experience, but also the fact that I think, we've talked about the kind of stereotyped idea of alcohol problems, and sometimes that's my concern that sometimes lived experiences are used in a way that might reinforce those kind of stereotypes. So yeah, I'm very keen on, a broad scope of lived experience perspectives that do kind of enhance that nuanced, diverse continuum model of alcohol problems that avoids that dichotomy.
Yeah. I think I fully agree. I mean, it's paramount that we put people with lived experience at the center. And there are so many people who have overcome an addiction or
Yes.
a drinking problem and who are still ashamed to share their stories. They're glad that it's over and nobody needs to know. But instead, I mean, they are heroes. I mean, they are
Yes.
really examples that we could use, particularly in a world where addiction is all around us, from smartphone to gambling to eating to, I mean, we are surrounded by things that are trying to draw us into an addiction. And people who have overcome an addiction I mean, they have experiences that we all could profit from. So I think there is absolutely no reason to be ashamed of. I think it's our duty to create an environment where these experiences can be shared without shame and negative consequences, because then
Yes,
that would be just so
absolutely.
good.
And sorry to interrupt it, but and also sharing recovery, to use the term, is so powerful in terms of we know that self-efficacy or people's belief in their ability to change is enhanced by seeing others recover and change, and it's one of the most important predictors of behavior change. So seeing visible recovery is so important, not just in terms of destigmatization, but just directly in terms of increasing people's
Absolutely.
belief in their own ability to change.
Just think of drinking problems at the workplace. I mean, there might be coworkers who have overcome addictions and you don't know that. You're struggling with your own drinking. You're just hoping that nobody finds out. And maybe you're working with someone who has overcome that and who could really, really help you, but it
Mm,
won't happen because nobody
mm,
knows from each other. So that is, I think that's just a waste of resources. But I mean, in Scotland, they have Recovery Month, they have recovery walks. And I'm really proud to announce that we will have the first German recovery walk in Leipzig this September. So there is a group of people with lived experience, and they founded an association, and they are organizing the walk. And I think they're expecting a lot of people, because that is really something that seems to be fitting, that there are so many people who are fed up with hiding their addiction
mm,
or their
mm.
recovery from addiction. And I think it's really a good way to go out and come out and show the world that these are real people, they are good people, and they are people who are proud of what they have achieved. So
Yes.
I think there is a lot of hope, or I think there's something that feels ripe, that
And sharing the lived experience, exposure or contact, as it's sometimes described, I think is so important because it humanizes the problem. I think a lot of what we've talked about is, the dehumanization and the blame and all those kind of things that really, you know, rely on or perpetrate detachment from the person and their lived experience. Again, I'm quite critical of kind of biomedical models, which again I think are kind of a bit wrapped up in illness or disease models because they focus people's thinking on kind of biological things like genetics or their what's going on in their brain, which play a role in mediating these kind of things, but really the driver for me of alcohol problems is people's lived experience. Life is tough, it's challenging, we're exposed to these environments that exploit our impulses, and a lot of people we've had difficult experiences, and it's natural to use alcohol, particularly if it's culturally normalized as a coping mechanism and so on. So, really humanizing that lived experience of alcohol problems, I think, is so important, not just for reducing stigma, but for also helping people understand what causes alcohol problems. It's not this kind of genetically predetermined thing. Even I think geneticists would admit that.
yeah, yeah, absolutely. What we also need to do is normalize non-drinking, because I think
Mm,
in many circumstances it's also stigmatized not to drink. And if I'm outing myself as an alcoholic in the moment I refuse to drink, I mean, that's a paradox. I mean, it doesn't make sense. It has to be normal that people don't drink. Nothing that I have to explain. So that's something that we all can do, I think.
yes, I really agree. And in the UK, there's some really good work, where there's some really kind of active or visible kind of movements or groups or individuals who are really, speaking out about how we need to normalize, non-drinking. My kind of argument is again, it's maybe slightly controversial and not a critique of normalizing non-drinking, but I also think sort of drinking moderately also needs to be kind of more acceptable. Like we definitely need more spaces where non-drinking is normalized, But, as someone who does now drink, in moderation, I'm still exposed sometimes to pressure to drink more than I want to. And, there's lots of people from a public health perspective who are not going to, stop drinking or are still going to want to drink on certain occasions. And sometimes I work with people whose goal is to control their drinking. And yeah, so we also kind of need to include drinking less as something that maybe is more normalized rather than, heavy drinking as always being the norm as it is in many contexts.
Yeah, and I think that will be easier when we have an honest conversation about drinking risks. I mean, the health risk of drinking. I mean, they start with the first drop and they increase exponentially the more you
Yes.
drink. But I mean, there is no safe level of drinking, and the less you drink, the better. And if this framing gets traction, then it's easier to, I think, to argue, well,
Yes. That's interesting.
you know,
Yeah, we've actually just recently ran an experiment testing a no safe level message, versus some alternative message. Because, yeah, I'm personally, I think, it's technically true what you say that there's no safe level, certainly from a physical health perspective. But I don't know if you saw it, there was a kind of series of pieces in the Addiction Journal recently arguing that we mustn't forget the kind of what has regarded as the social benefits of drinking in our kind of messaging and research and narratives, so that there's this kind of idea that I'm sympathetic to, that a no safe level might actually potentially backfire. It could turn some people off, whereas if we say there's benefits of cutting down, then maybe that's more palatable for a lot of people.
yeah, that's right. But I think pointing out the social benefits of drinking is always excluding people who categorically don't drink because
Mm,
they don't want to, or they
yeah.
can't, or they have made bad experiences with that.
Yes.
And
And
I often
others would argue
wonder,
the
I often
industry.
wonder whether this ritual, whether it's more the ritual or the expectations that I'll be
Yes.
more sociable if I'm drinking, because I'm sure that part of it is a placebo effect, that if
Of
I
course,
have
absolutely.
beer in my hand, I'm just a cooler person.
Yes.
So that's,
Yeah, without doubt, there's plenty of evidence, empirical evidence that shows expectancies. If you put someone in a different context or give them alcohol-free beer and all these kind of things, there's a huge psychological expectation role, placebo effect from drinking. And of course, everyone knows the kind of benefits, particularly with alcohol industry advertising or alcohol advertising. We kind of don't need to play into that. But I still think there's a kind of need to recognize, that if people feel like they're being told what to do or that the
yeah,
benefits that they believe in are being denied, they can be
that's right.
defensive.
I agree, that would backfire. And it has to be an individual choice and remain. I mean, nobody wants to go back to a total prohibition. But I mean, well, we are far away from that. I mean, that
Yes.
is not the danger. But we still have a big industry who is really trying to sell as much alcohol as possible, employing all kinds of messaging strategies that kind of enforce a very attractive message or narrative of individual responsibility and competence that we all love to hear, but we have to make clear that this is a lie. It is discriminatory against vulnerable people. There are many of them. I mean, there are so many people with alcohol problems, and it's cynical because they preach responsible drinking and they make their profits from irresponsible drinking.
Yeah, absolutely. And that reminded me of the idea of, certain voices that have said stigma can be a force for good or protective or even disapproval. I mean, obviously, stigma itself is a harmful practice, so it's a non-starter. But if we think about social norms, then, there's some complexity there. But the idea that you protect, overall society at the expense of making the people with severe problems more stigmatized is obviously ridiculous. And yeah, we worked together on a paper trying to push back against that.
Yeah.
George, Jorg, thank you so much. Do you have any final thoughts or any kind of key take-home messages in terms of stigma of alcohol dependence? We've certainly covered a lot of ground, though, so no pressure if not.
I really enjoyed this conversation. I think
Me too.
it's a moving field, and I think it's moving in the right direction. We
Yes.
can see it, and it's good to see the connections between the individual and society. Yeah. So I think, yeah, I agree. We covered a lot of ground.
Yes.
I'm really grateful for having
Well,
you guest.
yeah, I'm so grateful for having you on. I've wanted to for a long time, and all your work was so influential in, certainly, yeah, kind of leading up to my PhD and subsequently. Yeah, it's a real privilege. Yeah, thank you so much again for your time, and we'll keep in touch.
Keep in touch. Bye bye.